Assalamu alaikum, ladies and gentlemen. With program follow-up, I'm your host Shujat Ahmed to cover another issue which is related to number of different subjects, and that is coronavirus. Coronavirus has now affected over 100 countries in the world and have over 100,000 patients with more than 4,000 casualties occurred. This virus not even has influence on health, it has influence on economy, it has influence on society, it has influence on the culture. As far as economy is concerned, developed economies are hit by number one oil prices, which has gone down, and that prices has been transmitted to the developing countries, where there is a fear of investment uncertainty, and investors are taking out their money. Now, the second point is spending on tourism, culture, and entertainment, which has significant proportion in the GDP of the developed countries, and Pakistan, being one of the other country in the developing world, is now promoting its tourism. So how these things are going to influence the economy, how coronavirus is going to have a hit on our economy, and how we are going to come out of this whole pandemic, what is the way forward. For this, we have with us Dr. Waqar Ahmed, who is Joint Executive Director at SDPI, and Ms. Aisha Kasrani, who is Senior Research Associate at SDPI. Looking at this whole corona and its economic impact, and as ADB has also said that it will affect 1.5% of the GDP. So what do you think that how trade and this whole process is going to be influenced?
Yes, thank you, Shajat. I think one has to take a step back here and really look into the very sort of idea that this is something very new for most policymakers to deal with, and to understand what channels through which such pandemics impact society, economy, and of course the very nature of work. Basically, it's very difficult, and of course for many of us it is going to take some time to come to grips with how it is going to impact us. You rightly said that this will have implications for travel, for transportation of goods and services, for example, and this in turn is going to impact the national incomes in the developing countries, and Pakistan being no exception, of course. But of course, from a policymaker's lens, it is important to actually pinpoint those transmission mechanisms through which such pandemics impact the economy and the society. So basically, to start with, Pakistan is already seeing that a large part of your imports, which go into your production of local goods as well as your exports, may actually see volatility in their supplies, primarily because many of those imports come from those countries who have been hit hard by the coronavirus. That's one. So anytime there's any external shock impacting your trade balance, of course, it impacts several other macroeconomic fundamentals as well, which could include employment, inflation. You're already seeing the behavior of exchange rate. For example, Pakistani rupee has gone down by almost 4 rupees once the news around the spread of coronavirus came in, and of course the fears of recession in European Union and many other parts of the world with whom Pakistan trades. As this news was coming in, rupee was shedding its value. Then, of course, one also has to see that there would be impact on migration and remittances, which of course my colleague Aisha can cover. And you could also have impact on aid inflows in the developing countries, because the capacity of developed countries to service and continue their commitment for development needs of or welfare needs of developing countries could see a hit, because the developed countries would have to expand their own social protection and social safety nets going forward. So aid inflows to developing countries could also be compromised. And then finally, if I can add, that a large part of your foreign direct investment that comes in is contingent upon the travel of business persons, their movement of their assets and human resource. And with the evolving situation, and if there are travel embargoes across countries, the inflows of foreign investment to Pakistan may also be a question mark, at least in the short term.
I should bring a point from Dr. Bakar's response about the migration and its impact. We are looking at as Pakistan is moving towards this travel industry and promotion of tourism, and then going towards that migration effect. How you're seeing this whole scenario, that where Pakistan is and what Pakistan should do to curtail the impact.
Thank you for having me here, Shajat. About the travel industry, I think at this point, Pakistan is still in its beginning phases. So we are making efforts to boost our travel industry and tourism industry, but we are not at the peak yet. So I think the loss that we face here would not be too much right now, because we haven't really invested too much in it right now. But as far as migration is concerned, yes, we will be impacted by it, because we have about 9.1 billion people overseas from Pakistan, and they send in remittances, and a huge part of our economy is dependent on the remittances. In 2019, we received 21 billion US dollars. So, and that rate has always been increasing over the years, but the rate will obviously slow down as people who are working in these other countries, they are also facing economic recessions. They have been working from home or not working, being able to go to work at all. So that will have an impact on how the remittances are transferred or whether they are able to earn or not. And secondly, I would also like to raise that within Pakistan as well, there are a lot of rural to urban migrants who come to the urban areas for daily wage or any casual labor that they do. And if this event rises to the point that people have to work from home, maybe you and I and people who work from offices can do that, but people who are out in the streets and who have to go out to work and get a wage to earn and to feed the mouths that they have at home, that would be a very serious concern.
My next question is to you both. Like, in this whole picture, there is that cash flow phenomenon present, but on the other side, while looking at cases in other parts of the world, some of the countries even they are discouraging this cash flow process, that you don't need to print more money, or if money is in the hands of people, money is also contaminated. So now looking at Pakistan, if we try to dispose of this money, paper money, and we don't have alternate, so where is the economy going in that scenario? Either we'll be printing more money, we'll be printing more paper money, we'll be going towards coins, or what should be the alternate then?
I think your question is very important, and it doesn't just probably apply to money as an asset. It applies to a lot of other goods that are in trade at the moment. And this is precisely why I was suggesting that import inflows could see a hit, and many of those imports that go into your production process have already been quarantined. Already you have the local industry in Pakistan telling us that their import supplies have been sort of quarantined or detained, or that the imports are not being allowed to ship from the origin even, just because the shipment may contain something that sort of can impact the destination country. So I think the problem that we have sort of diagnosed but don't have a solution, don't have an immediate solution around, is something which requires a lot of consultation at the moment. It requires a lot of transdisciplinary brainstorming at the moment. One really needs to sit down, and I go back to my point that probably policymakers in this regard have to take a lead in convening public-private dialogues on how best to tackle the situation, because it's not just the scientists or the doctors or any one or single fraternity who would have an answer to this question. Anything, any good or commodity that is in trade at the moment, according to the doctors, it sort of provides or sort of acts as a threat, especially if coming from countries which have higher incidence of coronavirus. So again, it just goes back to how best we can open up the consultative process, how countries can quickly brainstorm and put together short-term policies which mitigate or minimize the impact of or the threat being posed by goods in trade to their society and economy.
I think on that note, we are also supposed to take care of how we manage the situation, how we dispense all the information, because we see there is a lot of panic being created. And even in the markets, if we go, people are hoarding up things that are daily use or items or even dry food items. So I think it's a balance of what Dr. Vakar has said of consultative process about how to manage the inflow of trade and goods and how to manage that, but also how to keep the expectations of people in compliance with what the situation is, because right now it's just getting into a very panicked situation.
But then, looking at this Pakistani society, how we are going to manage this consumption and saving behavior, because we are more into more of a consumer type of society rather than society more going towards the saving mode.
No, I think it's important to realize that we really do not have at the moment local level intervention or intervention which sort of has been innovated to address or act as a local level response. We are essentially relying on the expertise and technical advice provided to the country from the WHO and, of course, other relevant organizations. So yes, being a consumption society means that you are on the receiving end of things. But let's also take this crisis as an opportunity to do something which we haven't done. For example, we don't have local level research around, as I said, how to mitigate or deal with the impact of pandemics. And I think the opportunity here is for institutions like, for example, the Higher Education Commission, Pakistan Science Foundation, and many other funders of local research, that they need to encourage policy think tanks in this country to come up with quick and rapid research around this subject, which is policy relevant, which is grounded in evidence, and supports the government in terms of bringing real-time evidence and solutions on their table.
And on that, while we do encourage our local research organizations to actually focus on this, I think it is one of the very rare events in which the whole world is in it together. So I think it's a very good opportunity to learn from what other people are doing. I heard that the cases in Wuhan are actually decreasing now. So I think trying to see what we can take from their cases and what the capacity of our government is to see what we can implement here is also very important.
Now you have taken the name of Wuhan, which has been the epicenter. Can we adapt those ingredients which were there adopted by the Chinese government in our system?
I don't think we can take them as they are, because their capacities, whatever facilities that they have, are completely different on a different scale than what we have in Pakistan. But I'll let Dr. Vakar talk about that in more detail.
No, I think there are lessons to learn from what interventions the Chinese government has done in Wuhan. It is to their credit that they were able to mobilize in very less time the interventions related to health, related to livelihoods, related to protection of people, food security of people, for example. And there are lessons to be learned how to move fast in these difficult circumstances. I'm sure that there are teams coming out of Wuhan who have first-hand experience, who are helping countries such as Iran and Italy now to deal with this as well. And we probably need to learn from those experiences as fast as we can.
Thank you, Dr. Bakar, for your valuable feedback and suggesting good and timely way forward that what Pakistan government or the stakeholders involved in this whole process should do. Thank you, Aisha Kasrani, for highlighting some of the various issues on a very short notice. So, ladies and gentlemen, now hearing both of the experts on from economy, from migration, and tourism side, what Pakistan needs to do. Though there were pandemics in the world in the past which were curtailed, but it has some cost. We may be bearing some cost. The efforts should be to minimize this. And how this is going to be minimized, we need to come up with a research at local level. We need to come up with more stakeholder consultations, more participation of the stakeholders. We need to come up with solutions which are acceptable to society. The number of people are saying that isolation can be the best solution. Isolation can be one of the solutions, but it cannot be one of the best solutions. So how we are going to curtail, or how we are going to minimize the losses, or how we are going to minimize the economic impact of this virus, for this we have to work together and we have to work very efficiently. Thank you very much.